Welcome to Home Health Revealed, where we share real stories from industry leaders about home health, palliative, and hospice care. Brought to you by Velocity. Velocity's easy-to-read coding and revenue cycle dashboards let you grab your cup of coffee and quickly see the health of your organization.
Now, Sarah, we do appreciate you guys are a great partner of ours. But before we get started and start asking some of our guests some questions, I think it would be great if you would tell the audience a little bit about who you are and a little bit about Better RX.
Amazing. Well, thank you for having me. I am Sara Nigro, VP of Partnerships at Better RX. And for those of you who have not heard of us, we are a hospice pharmacy technology. And what really sets us apart is that we don't actually own the medications ourselves. And that really helps our team double down on cost control for agencies, which in providing patient comfort and patient care, you can't do that if you're not financially stable. So we really do have a two-pronged approach in terms of covering your pharmacy from a clinical standpoint as well as the technology. So we're helping your nurses become faster, more efficient at their jobs, and we're really helping inform their ordering behaviors. And then we're actually giving you access to real-time interchange manager type of activations so that your team is more dynamic with the medications that they're ordering so that they are for the patient's comfort and financially sound.
Yeah, if they haven't heard of Better RX, if they've been to a conference, I will tell you Better RX has by far the best booths.
They do.
Ever. They're
I'm
very creative in what they do. So
if
you see a really nice creative booth, like, maybe a bus is there or a van or people are dressed up, you found Better RX.
Yep.
You know what I mean?
Find the orange.
Yeah.
Find the orange, find the happiest team, and you're pretty much at
You
Better
guys
RX.
do have a very joyful team. That's some truth right there.
Thanks for being part of the show.
Thank you for having me.
So it's the afternoon of the Alliance Conference here in Chicago, and we are here, Sara and I kicked Michael out of the booth, sent him on home on the plane, said, get lost, and got to take over his microphone, so things are good.
It sounds better on you.
It does. I'll tell him. Don't tell him we said that. But I am here with Jake Panowicz, and he is going to tell us about his agency. We're going to ask him some questions here all about how this conference is going. So, Jake, tell us about where you're from and what you do.
Yeah, my name is Jake Panowicz. I'm out of Omaha, Nebraska, and I own a company called Haven Hospice with 4 other partners. We're a small company. We've been around now just a little over a year, and our census is just at that 70 mark. We keep flirting with it, and then the weekend happens and we'll be kind of knocked down a little bit. But I've been in the industry since 2007. Started with home health care and been with hospice since 2010. So
That's
amazing.
great.
Yeah.
So congrats on growing something new.
yeah, it's this is the third startup I've done. The first hospice company I ever did was a startup. That was Serene Care Hospice in Omaha, Nebraska. We ended up selling the home health care and the hospice companies back in 2021. So when this opportunity kind of came my way, I knew I could find the right team members, and that kind of just made it, made it all more possible for me to be able to do this so quickly.
I cannot stress enough how important it is, and having built businesses, I think you'll agree, having people that you can pull in, that you can trust to get something done makes all the difference, especially when you're starting something new.
100%. I with the team that we have, that's the biggest challenge, I think, with any company, right? Is if you don't have people that are with you that have the same purpose in mind, you're never going to succeed. So having the same people that have the right purpose, that want to do, things for the right reasons, you have the same goals, the same mission, it makes it very, very easy. And I say that it's been a long, hard first year, but without this team, there's no way I would have been able to do it. So,
Sounds like you have a great team.
It's really incredible. I am curious. So, starting up a hospice, there is such a need as the aging population grows. What's your best advice from a financial standpoint for an agency that's just starting up? Like, what is you must follow this best practice if you had one that you'd recommend for them?
I don't know if it's one single best practice overall. When you're starting a new agency, you just have to be so meticulous in every little thing you do, right? You have to look at everything from, your accreditation company. What are they like? How often do they come out? What's their response rate? Everything from how long is it going to take you to get through that state licensure, if you have it, Nebraska does, to the accreditation, to taking your first patient. You have to be very meticulous in every little thing you do. And you have to calculate for, what's going to happen next. Because I know when I did this, I started it back in January of 2024. And I had everything down, and I had the timeline down. And every time I thought I had the timeline perfect in my head, I would be like, nope, this could happen, that could happen. So I think you just got to be very strategic in how you do things. And then plan for the unknown, right? Mm-hmm. We had no clue that it was going to take so long to get the Medicare number. We got certified September 12th, and the Medicare number didn't come until almost December.
Wow.
So here we are in January. I'm still putting money in, and we actually got to the point to where I was putting, kind of my last few dollars in and everything like that. So you just got to plan, be incredibly strategic on how you do everything.
What is the one financial metric that you wish you never had to look at again?
I would probably say the pharmacy bills. No matter what you think you're going to do with a patient, no matter what the CTI might be, there's always going to be something else you're going to end up possibly covering, or something comes up, or, you're changing the actual diagnosis of the patient, especially when the patient takes a turn. So if I could never look at that again and just kind of move forward, and someone just told me you're doing well, I'd be happy.
Yeah. It is said that the most expensive functions of a hospice are the pharmacy, medications, and the labor, and so if one of those goes haywire, it really can set you off. So I definitely understand that, and I'm sorry that you guys have experienced that. There are better options.
Are there better options?
Crazy.
I've heard that.
But that's true. If you need a medication in a certain situation or a crisis, or if you have a new nurse or care team member that's not super aware of the cost of the drug, that can really set you back. So it's definitely something you need to keep an eye on, and that everybody as a unit for the whole agency needs to be really aware of how their decisions impact your bottom line.
Absolutely, and that's, that kind of starts at the top, just making sure that you educate your staff. And it's a fine line, it's very hard for me as an owner and director to kind of sit down and talk with the staff as far as, this medication is very expensive, here's the different routes we can go and everything. Sometimes you're going to have to just bite the bullet and you're going to have to do it. But yeah, the more you educate your team, the better, versed they are. And, okay, don't use this, or what about this medication? That's kind of the best way to do it. So
yeah, drug substitutes with the same therapeutic value.
Here's a creative question. Are you pretty creative? You're great at starting businesses.
I think so. My wife would say so. Yeah, I'm creative. Yeah.
If your agency were a movie, what would the title of your movie be?
My agency, what is the movie? What would the title be? Family Ties.
I like that.
Family Ties.
Quick.
Do you remember the
Yes.
TV show from the 80s?
Yes.
Family Ties. Yeah.
All right, I like it.
That has such a strong parallel back to hospice.
It does.
So.
Especially with Michael. Yeah.
Yeah.
Family Ties would be it.
Yes. Speaking of movies, we just watched Happy Gilmore 2 this week. Did you watch it?
Earmuffs. No, but I did fall asleep the other night to Happy Gilmore 1.
Okay.
Yeah.
I have not watched it yet, but I'm waiting for my daughter. She was gone over the weekend. She wanted to watch it with me, so I'm waiting to watch with her. But I heard that it is incredibly cheesy,
Totally.
funny. The cameos are ridiculous.
Yes.
And if you expected anything else, come on, do you not know Adam Sandler movies?
Right. Exactly.
So.
I went through this really unusual phase where I was on a mission to watch as many Adam Sandler movies that he's written, produced, or been in. He is so talented. And to your point, if you go into that movie thinking it's going to be something that it's not, I want Slap Happy.
Yeah.
So I'll have to check it out.
All right, I'll do one last question. And I think I know the answer, but I'll ask it anyways. When it comes to budgets and planning for your businesses, are you more of a spreadsheet superstar or a napkin math kind of person?
I'm visual, so spreadsheet, everything is color coordinated. The weekdays, Monday through Friday, are color coordinated. Weekends are color coordinated, and then each month is color coordinated. again, I'm very visual, so I've got to have it all down there. So, a napkin. I'd be bankrupt by now if I used a napkin, I think.
You'd be surprised.
Yeah,
Yes.
I'm sure there's. Hey, if it's all up here and they can, they know what they're doing. For me, though, I need a constant reminder of what's coming up, what's going on. So.
Well, thanks a lot for stopping by and talking with us. It's been great talking with you. Do you have
Yeah.
any other questions you wanted to ask Jake?
No, honestly though, I feel like he is primed for like getting on a panel, because there are so many people starting agencies that are really running blind. And I know because I talk to a lot of them, and it'd be great, if there's some sort of mentorship or resource that you'd recommend that we
Yep.
can pass to them, or if they can get in touch with you somehow, because I think that there's, we were talking earlier with Demetris Harrell, and she was really pointing out like there's that need for mentorship from a peer-to-peer like C-suite level to really help like speed things up. So I don't know if that's something that you do or are willing to do, but I could see that being a really strong area for you.
Yeah, if somebody has great intentions and they're going to do things the right way, I'm always willing to help people out.
Yeah.
Even in Omaha, we've got a very competitive market there. And when I see, any of our competitors doing something, or if they could do it better, or if they're doing something that I know I can help in, I always try to step in and help out. So
It's awesome.
That's really great. There are so many people in this industry who are they're trying to do the right thing. They're on a mission in their market to really care for the patient. And when people have that mindset, we may be competitors in some ways, but I think at the end of the day, we're all trying to do the right thing and serve the patient well.
Well, and to be honest, without competition, I grew up team sports, but I love to compete. If you're not friends with your competitors, you're doing it wrong, because ultimately, if we can't serve somebody, I want to know who the next best person is to do so. And I think that applies to hospices as well.
Amen.
Absolutely.
Well, thanks so much.
Thank you.
Thank you.